All right, so some interesting news there, very pertinent for South Africa because we are part of this COVAX platform which allows countries to pool their negotiating power. COVAX then deals directly with the manufacturers of these vaccines, and then poorer countries can receive an equal number, or at least there's some sort of fair distribution of these vaccines, and they don't get caught up losing out because of negotiations or paying higher prices because they can't negotiate with clout. We're joined now by the Deputy Director General for Health, Dr. Anban Pillay. Dr. Pillay, I'm sure you heard what the WHO head was saying there about Pfizer. There will be 40 million Pfizer vaccines and 150, I think he said, of AstraZeneca. Those are in the pipeline for COVAX. Is that very good news for South Africa?
Yes, we were anticipating the AstraZeneca vaccine since the agreement between COVAX and AstraZeneca has been long-standing. The Pfizer deal had not been signed, and so it's good to hear that the Pfizer deal is now finalized, and those 40 million doses would allow a number of countries to access the Pfizer vaccine via this COVAX agreement.
But I mean, does it really? Because Pfizer needs that cold chain. We apparently weren't geared up for that. Will that really benefit South Africa or other African countries?
I think countries would be able to handle very small quantities of the Pfizer vaccine because of the storage limitations around it, and I think the 40 million may well be sufficient for that type of distribution within the city areas and where there is a minus 70-degree refrigeration for those types of.
But we're not at all yet covering the billions on the African continent. Let's be clear, and this small amount compared to the need, will South Africa even receive some of the first doses? We don't know. Could be the end of the year, like he says, before we get our first ones.
No, I'm not sure he said that. What he did say, I heard, was that there's 40 million doses that they've signed up with Pfizer. He also indicated that 150 million doses will be released in February, March, which is the first quarter. And South Africa is part of the first tranche of countries that will receive vaccines. What we don't know is how much we'll get of the 150. I understand by Friday next week, they'll confirm that, and then they'll start shipping that out sometime in February to each of the countries that have been part of the COVAX facility.
Yeah, that's what I was trying to say. There's so many countries now sharing 150 million doses. Do we even know we'll get anything in February?
Well, we're all expected to get something. I think that's the general principle that COVAX operates off. Everybody that's part of it in the first tranche will get a portion of the vaccines that they had put up their hands for. I think a second delivery will certainly come in quarter two, probably around April, May, given that that's the second delivery we understand that will be coming through. They did write to us a couple of days ago indicating that that's their plans in terms of providing additional doses.
All right, let's be clear about COVAX. I mean, the number of doses small at the moment, and when we get our full tranche, that'll only cover 10% of the South African population. So let's talk about the rest. The president announcing that the AstraZeneca vaccines had been procured for health workers. Firstly, will we meet the timeline? He said that the first doses would be in South Africa from the Serum Institute in India by the end of January.
We were in discussion with the Serum Institute today, and they've indicated that they're very much on track to make sure we get our vaccines by next week. On our side, we can say that all of the measures that we needed to put in place in terms of payments, regulatory issues, etc., are all on track, and so we don't anticipate any problems in receiving the vaccine next week.
All right, so this news was good news before the reports came out that we are paying way more than rich countries for this very same vaccine. How did that happen?
Well, when we first quoted the price, we also understood that the price that countries were going to pay was between $3 and $5, and so the price of $5.25 was way higher than that. And when we investigated and inquired as to why is it that we're being quoted a higher price, the response we received is that the price that developed countries paid was actually higher than us because they made a contribution to the research and development of these vaccines, which we don't have sight of, and so the price that we're seeing is a discount of that higher price. We obviously don't have sight of this. I'm simply reflecting the discussion and negotiation that we've had around the issue.
So this is something about research and development, but I mean, we have a good relationship with India. Surely that should have counted. Overall, European countries are even contributing to COVAX. So surely this wasn't meant to be a huge money-making exercise. Did we as South Africa allow this to happen by not negotiating at all?
No, we certainly negotiated. Our understanding and our investigations suggest that this is a tiered pricing approach, that since South Africa is an upper middle income country, this is a standard price. It's got nothing to do whether we paid now or paid earlier. It's the decision that they've taken at the Serum Institute around their pricing. I also understand
didn't you push back that we, as South Africa, would be paying more than $5? EU countries, I understand, paying around $3. Didn't we push back against that and say, come on, guys, look at the situation? The whole idea was that there would be justice and equity, and everybody would try and get their populations vaccinated.
Yeah, no, we did push back, but you can push back only to the extent that the seller is willing to sell to you. And in this case, remember that the Serum Institute was not really at this stage interested in selling to other markets because of the huge commitment both to the Indian market as well as to COVAX. So we had raised this and said, well, we think we should be paying a lower price. They went away, came back and said, well, we've done the calculations and you definitely an upper middle income country, so this is the price it's going to be, and you decide whether you want to take it or not. And so the question is, do we leave our healthcare workers without a vaccine, or do we negotiate around this? And our decision was that we need to accept that. If that is certainly the price, our investigation with the other AstraZeneca vaccine sold in other markets suggests it's a similar price for upper middle income countries, and so we had to settle on that.
So if we had to settle, I mean, doesn't that add to the huge concern, the argument that South Africa was way too late to enter the negotiations in the first place, and then you miss out on the first doses? Some poor countries are vaccinating their populations. India, for example, of course, they're good at making vaccines, but they're aiming for full coverage of their population. Were we late, and then we have to accept fewer vaccines and high prices?
Well, actually, those that were early in the vaccine game paid higher prices because they were paying for being first in the queue. That's the reason why they paid the higher prices in terms of the contribution towards R&D, etc. And the price you're seeing, which I'm saying is the European price, we've been told, is only part of the price that those countries paid. This price has got nothing to do with the whether you're early or late. It's a price related to your economic status in terms of whether you're upper or lower middle income, etc.
Does the health department, I mean, you going into negotiations, do you know which vaccines are currently available, at what prices around the world? Are we actively engaging in negotiations and really doing our best for South African citizens?
Well, that's our job as public servants, is to get the best deal for the country, to actively find vaccines, get the best price. South Africa has one of the lowest prices of medicines in the world. This has been globally recognized. There are a number of papers showing the prices that South Africa has for medicine. So we've always pursued low prices for medicines, and we'll continue to do so.
Yeah, and should we not be shamed again that countries like India are vaccinating their populations?
I'm not sure why we'd be shamed if India is vaccinating the population. As Dr. Tedros had indicated everybody needs to vaccinate, because if one country is not properly vaccinated, it's a risk to everybody. So we should be very happy that India is vaccinating their population.
No, I'm saying, should we not be shamed as South Africa that we are still waiting for the first doses, and those doses only cover medical workers, that we have no real timeline, no real sight of when all the vaccines will come, when we can achieve herd immunity. Experts are now talking about a third wave that will come before we have any sort of coverage in terms of vaccines.
Well, I think the president did make the point that our second tranche will certainly come in Q2, and most of the vaccines will then be available in Q2. Remember, most vaccines were only registered in December of 2020, and those vaccine manufacturers are now, after getting the regulatory approval, started producing the vaccines. Vaccines take a fairly long time to produce, and
Dr. Pillay, sorry, I lost that connection just very quickly, because we are asking South Africans what they think, given the reports that are coming back, given that experts are saying even pricing-wise we should be paying less than what the health department is saying. As the Health Department of South Africa, have you done your best to ensure that these crucial vaccines are secured as quickly as possible for the population?
Certainly, we've done our best that we could in the circumstances. Yes, definitely.
All right, Deputy Director General for Health, Dr. Anban Pillay. We take a short break. Lots more to come on The Full View. Stay with us.